So, in terms of urban health today, I mean, what, your overview on, you've taken care of thousands of people, hypertension, congestive heart failure, and obviously coronary disease and heart attacks and strokes. I mean, not everybody has the same access to quality food and quality education on lifestyle and affording what it takes to have a quality lifestyle and affording your medication and having the support. I mean, just share with us a little bit on, are you optimistic about the American medical system and your perception of disparities that require fixing, or you're pessimistic and there's, in particularly in your administrative role, is there just massive work to do to, really treat all patients as one single high quality, effort?
Man, well, that's a mouthful of a question, a loaded
Yeah, it
question.
is.
And I think I'll start by saying it became glaringly obvious to me about the disparities in the care that's delivered when I experienced it personally with my wife. And so coming out of the pandemic, and she developed COVID without any substantial symptoms at all, but probably about within a month or so, for the first time ever, she said she was having chest pain. Now, she didn't tell me right away. And so we're at that age and so forth. And so she says she was out walking the dog, and then she took my daughter to a birthday dinner. And so she's calling me from the car and she says, Columbus, I'm having chest discomfort. I think I'm having a heart attack. And my wife is like the most optimistic person in the world and minimizes everything in life. She's just like, oh, no, I'm okay. It's fine. It's fine. So for her to call me, I said, okay. I said, well, what do you mean? What's going on? Well, I took the dog out and I started having pain when I started walking. So I came back and I took 2 aspirin. She never takes medication.
Mhm.
She's like anti-taking medication if she can. And so I said, okay, called a friend of mine who was closer to her, who's a physician. I said, okay, go by and go see her. And I said, you need to call the paramedics. She said, I'm not calling. So paramedics came by and so forth. Of course, the EKG didn't show much, which it may not, and so forth. And, she didn't go. She told them, dismiss them. So I said, no, you're going to the hospital. Now, this hospital happened to be a hospital where I've done thousands of interventions, but I'm wearing a jogging suit as I ran out the door, did not have my badge, did not have my lab coat or anything else of that sort. So we arrived during the peri-pandemic time. And so we're outside the ER, kind of just waiting as she's still having chest discomfort and looking somewhat uncomfortable. I asked, I tell the nurse, and so I understand our culture in terms of medicine, that I can't be a domineering husband. I definitely understand who I am in my own skin. I can't appear as if I'm being aggressive or anxious at all. So, I say, hey, she described it as some pressure in left chest, brand new. Stuttering symptoms have been coming on for the past several hours. Wanted to bring her in to make sure, hey, is it something we have to worry about or not? And everything, as they continue to look past her, they ignore what I say, which is fine. And they ask her, so she's uncomfortable. They finally bring her back. And then she calls as I'm waiting that they haven't taken the EKG, and she's sitting back there just waiting by herself in the front. So at this point, now Dr. Columbus steps in. And so I'm calling up everyone on the phone because, of course, I know everyone there. And I start putting calls through. And next thing you know, she's like, I don't know what happened. Everything just started happening. Like, yeah, okay. And gets EKG, and then now everyone's open to communicating with me. And, and it brought me for a moment. I said, well, was this just by chance or was this intentional? Was it by chance or was it intentional? When we understand the importance of that early EKG, at least for initial stratification of if is this someone I have to worry about or not? Do I put them on the monitor or not? And so it made me start to begin to think about how we deliver care, and what if there's individuals who don't have someone who can advocate for them.
Right.
And this resonates with the issue of not only gender, which we understand the perilous impact for women across all ethnicities and racial background descriptions, that they are overlooked in the medical world. Oftentimes, we know the plight of African Americans. We know the rates. You can plug in the numbers. African Americans are 2 or 3 times more likely to die of fill in the blank. breast cancer, heart failure, readmission, death, sudden cardiac death, less likely to get stents, more likely to have high blood pressure, more likely to have it. And so, as you kind of look back and you say, man, well, what can I do about this? Because we understand that we're all over 99.9% the same. So race is a social construct. Is this genetic? What can we do really to change this paradigm? And we understand that it's not genetic, it's an issue of circumstances, the social determinants of health. And I don't know, you were talking about movies a little bit earlier. You mentioned Blazing Saddles, but I'm gonna throw one at you a little bit earlier than that. Have you ever seen Trading Places with Eddie Murphy?
Oh, yeah, favorite.
One of the best, right? And I love talking about that movie when I talk about disparities, because you look at really its opportunities. And when they change and flip the opportunities of the individuals, all of a sudden you saw what life circumstances did to them in that moment, both. And so very similarly, we understand. And so that's why there's been some phenomenal research that's been done that looks at, for instance, high blood pressure. Take one area of disparity that's such a glaring one inside the United States of African Americans, and the perilous impact that leads to heart failure and to kidney failure too as well. This cardio kidney metabolic syndrome,
Right.
great
New term.
presidential advisory that came out there. I read through that just this past week. But when you look at that, you look at individuals who originate in West Africa, then the Caribbean, then the United States. You see this upward trajectory of blood pressure that actually inside West Africa, the blood pressure is markedly lower than even Caucasians in the United States. So that suggests strongly it's not a genetic issue. This is this is a circumstance issue. This is something with our environment, something with our circumstance that's here. As I always say, the stress. That stress, both life stressors, nutritional stress, that plays a role, and it ignites in this crucible of conflict of communities that people live in.